thought we would demonstrate a couple of things. I thought number one, a length of rope. And you'll notice with this length of rope, the rope has two ends. We just cut off the ends of the rope. Does that mean the rope no longer has ends? No, it has new ends. And what I will do is, may I hand you one end of the rope? Thank you. May I hand you the other end of the rope? I'm going to ask you both, please, to be kind to each other, but to tug on the rope to demonstrate it is a rope. Thank you. I will borrow the rope back. Thank you. And I will hand you the scissors. I'm going to ask you, if you will, please, to open the scissors up. Perfect. And I'll have you hold the scissors up high. Please do not cut yet. I'm just looking to see, we want to get about to the center, and that will be good. Okay, very good. Okay. And now, I will ask you, if you will, now you may use the scissors in their appropriate mode, because I will set this in, and I will have you actually cut. Perfect. So we have cut the rope close to center. Perfect. And this represents what we were talking about in medical jurisprudence and medical ethics. An individual has been wronged. He or she feels that his or her life has been cut in half. Now, we may attempt to put their life back together. Please don't try this at home. It's hard on the teeth. You will tighten that knot down so it's tight. And in fact, the individual may feel as if his life has been somewhat put back together, but he or she would truly like to be made whole. And that, in fact, is the reason that we engage in courtroom proceedings to help make the individual whole again. Civil cases, typically monetary recompense, or what we would call green poultice, to heal and salve the wound. Now, I'm going to ask if you will pick up the scissors a moment, and you know the difference between fingers and rope, yes? I'm asking you here, we'll trim this knot. Excellent, thank you. And now I'm going to ask you, if you will, please, to take the scissors, and I will have you gently tap the knot 3 times. 1, 2, 3. Thank you, and hopefully remembering the burden of proof. In most civil cases, preponderance of the evidence, greater than 51%. In those special cases of termination of life-sustaining equipment or termination of parental rights, we know it's clear and convincing evidence. You remember the Cruzan case. And beyond a reasonable doubt, in criminal cases, which would be 90% or better, our goal is to make the individual whole again. Thank you. One more visual demonstration, if we might. A deck of cards. Hopefully these cards are completely mixed and random. And I will ask, may I ask you please to say stop at any time?
Stop.
Very good. I'm going to have you please remove the card at which you stop me. I do not want to see it. You may show it to the classroom. I do not want to see it. I'll have you show it to the classroom, and then I'll have you set it face down so I can't see what the card is. Is it down?
Yes.
Excellent. I'm going to hand you the shuffle deck. I'm going to ask you, please, just to place your cards somewhere into the deck and then mix the cards. So the cards are completely mixed and random. Excellent. And You may shuffle as many times as you would like.
One more time. Okay, sure.
Thank you. Are you satisfied that they are randomly mixed? And now we will take this deck of cards, spreading them out. In the practice of medicine, we want it to be performed appropriately. You are held to a standard of having skill, expertise, and knowledge. So when a patient presents to you and you are thinking of the appropriate treatment approach, what you do not want to do is to do this, to cavalierly reach into your armamentarium of treatment approaches and randomly pick one out. Imagine your surprise when that is not your selected card. Imagine my surprise if it had been. Were we to practice medicine that cavalierly, we would most definitely need to have one of these, our malpractice insurance policy, which we need to have anyway when we're practicing medicine. I, as a magician, also have to carry my magician's insurance, because if I perform magic that cavalierly, I need to have a backup. The most common contract entered in the United States is the insurance contract. The least often read document in the United States is the insurance contract. Please, when you obtain your malpractice insurance policy, be certain to read the conditions to be certain that it applies to your medical practice. The conditions of this policy: number one, all parties involved must be playing with a full deck. Hopefully we are. And then it says, when in doubt, please look to the policy and hopefully then we're able to find the answer that we need. Thank you all. See you tomorrow morning at 8 a.m. We'll do it again, and we will review for the exam whenever that's scheduled. I don't know when the exam is scheduled, but I know the review will be tomorrow. We'll cover everything. Thank you.